Hi, I'm Merit Sokovich. I'm an ALS physician and scientist. I direct the Healy Center for ALS at Mass General Hospital. I'm also the chief of neurology at Mass General Hospital. So ALS, which stands for amyotrophic lateral sclerosis, is what I call a neurodegenerative disease. This is an illness that can strike people really in any age, from 20 to 100, but typically in the mid-50s. And it progresses, unfortunately, really rapidly over, on average, 3 to 5 years. ALS affects predominantly the motor neurons. So those are the nerves that go directly to your muscles, and they control movement and strength. When people have ALS, their motor neurons or their motor nerves are injured, and that leads to difficulty with muscle strength in the limbs, in the muscles of speech, the muscles of swallowing, and also the muscles of breathing. ALS can strike actually in any muscle first in the body. It tends to start distally, so in the foot or the hand. It starts with muscle weakness, and so that can lead to people having difficulty walking, and then it often progresses to the same limb. So it might progress to the rest of that leg and then to the other leg, so that people eventually cannot walk and might need an assistive technology like a wheelchair. It also affects the arms, so often, again, starts with the hands, so people might have a hard time opening a jar or writing or typing, and then it can go to involve the entire arms. So at some point, people become what we call completely plegic, where they can't use their arms or legs, and they really need other people or technology to help them do the things that they want to do on their day-to-day basis. But ALS doesn't stop in the limbs. It also affects the bulbar muscles, and so those include speech, swallowing, and breathing. Because it can affect swallowing, people can lose weight, and we try to be very proactive about minimizing weight loss, because we know people do better who can keep their weight up and keep their nutrition up. Sometimes people need feeding tubes because they can't swallow. It also becomes hard to take medications. And lastly, it can affect breathing, and that has impact on how one sleeps, how one talks. Communication is a big challenge in ALS. One of the muscles, though, that is preserved really for a long time in people with ALS are the muscles of eye movement. Because the eye movements are largely spared, it does give an opening for options for communication. So there's lots of devices that people can manipulate with their eye movements that allow them to communicate. But this is an illness where you really need a team to be really proactive and make sure you help people in everything that's going on with them, and proactively, so that they can function and have the best quality of life possible. In the last couple years, the field has really learned that there are some cognitive changes in people with ALS. People can have subtle changes in their personality. So it's more of a behavior change rather than a cognition. Maybe being a little more irritable or disinhibited. Some people have a little apathy. There are different signs, but it's really actually important for the caregivers to know about this. So now most of the clinics will actually screen our patients with a 5-minute test for this. Because if somebody does have these subtle signs, there's things you can do, again, to work with their caregiver so that they know about it. So maybe if they do get irritable about something, that's a little change in personality, that their caregivers don't get upset about it. There were some discoveries of some gene mutations that cause both ALS and an illness called frontotemporal dysfunction in the same families. So the genetic findings started to link these two disorders, and that led to people starting to do a little more cognitive testing on people with ALS, and finding that actually about half of our patients have some evidence of frontotemporal dysfunction. For most of those people, it's subtle, so you have to bring it out by the testing or asking the family about it. But for about 10% of people with ALS, it's actually a very prominent symptom. There are other symptoms that's really important for caregivers to know about and pay attention to. And one of them is pain. Sometimes some of the joints can get frozen because of the weakness, particularly the shoulders. So again, it's really important to be very proactive, have a physical therapist involved, and make sure that people are getting range of motion and other approaches to minimize the risk. Some of the increased tone, or what we call spasticity in people with ALS, can be actually very painful for people. People can get muscle cramps, like often in the middle of the night, that wake them up, that are extraordinarily painful. The other symptoms that are important to ask about are fatigue. The illness can cause fatigue for a lot of reasons. Sometimes people aren't sleeping well because of the mobility challenges or because of the pain. But also the illness is what we call a hypermetabolic illness. So people are actually burning about 30% more calories than they would have normally without this illness. And so that can make them actually lose weight or actually not have enough fuel in a way to do the things that they want to do. I think the caregiver is so critical for this illness, whether that's somebody from your family or somebody from a healthcare profession. If they're positive and they're hopeful and they're there to enable somebody to do the things that they want to do, they're adding a lot to someone's life and making it possible for them to do the things that they want and to feel like there is some hope. The good news is there's a lot more care options now than there were a decade ago, and we're actually seeing people living longer because of those care interventions and the technology. I'm confident that technology has already changed the lifespan and the quality of life for people with ALS. Both care and research for people with ALS has to be very personalized and tailored to the person. No two people with ALS are alike. And as a caregiver, you really have to know your patient. You have to get to know their wishes, what they want to do, and how to work with them. So I just encourage you to spend that time with someone, get to know them, and find out what works best for them.